afternoon. Welcome to another amazing show at Ditokello Tsa Hao. I am your amazing host, Tshepo Ngoato, and today we're going to be talking about a very interesting discussion. Sex, gender, and sexuality, where we know that our community lacks knowledge about it, and entirely some want to get the knowledge about it, but they don't know how. And before we actually go to that discussion, kindly follow us on our social media pages at Senec_trust and simply just go to our call to action number 067-267-3103. And today's discussion is not just about you as a male, female, and etc. But you normally most of the times there are certain people who say, no, when are you not this, when are you this? But again, also when we look at healthcare facilities, we normally don't talk about this certain conversations. So I think it's one of those taboo conversations that we just try and leave them out and not talk about them. But within that, I think it's much better to go into the discussion and literally hear a bit more about it. And we've got a very interesting young guy who is a very profound, I could say a speaker, because he is his knowledge and he knows about majority of the things that we'll literally be talking about. And how are you?
I'm doing well, thanks. How are you doing?
Extremely good. It's a beautiful Monday. And kachiko mvetu kare weekend dinner, people are having fun and all that. But I think again, how was your weekend?
My weekend was quite restful. I took the decision to take a break from the world that be. So I found it quite refreshing. Thank you very much.
No, besides that, can you kindly tell us a bit about yourself? I may know about you, but the certain people who are out there don't know about you. Who are you? What do you do? And your line of experience and expertise and the things that people don't know about you. Awan.
Okay. So I am Tumelo Rasebopye. A lot of my peers in the social justice space and in higher education would know me by the name Duke. So either Duke or Tumelo. I work at the University of Pretoria as a diversity and inclusion specialist in the transformation office. I also work as the national chairperson for the Gender Practitioners Community of Practice. And that's just the community of practice across all public universities. This does work around gender inclusivity, gender justice, and gender equity, particularly looking to combat and address things like sexual and gender-based violence within the higher education sector. So the bulk of my work and advocacy is in higher education, is in the post-schooling and education and training sector. And yeah, that's really what I do, focusing predominantly around sexual and gender-based violence, but a lot of it also naturally leads to work around gender diversity and how you facilitate inclusion at that level.
Okay. Since you spoke a bit about gender, can you go into detail more in that, entirely when you're talking about what are the barriers pertaining sex, gender, and sexuality in healthcare facilities? Probably you have seen in campus levels and outside.
So, I mean, look, I think the starting factor is that we tend to not have an understanding of what we really mean when we speak about sex, gender, and sexualities. One, we tend to think that all bodies are pretty much born the same. So when we speak about sex and speak about the sex characteristics, we find that we assume our bodies, as far as even our reproductive organs are concerned, our genitalia are all going to be born and have the same outcome. And that's what we mean around a binary. So very often in conversations even around our bodies, we are completely ignorant or completely ignoring the realities of intersex bodies and intersex lives. So, I mean, I think that's one start as far as we're thinking about sex. As far as gender is concerned, we predominantly are speaking around people's expectations as far as the societal expectations, the roles that we would play. These are usually what either an individual may think as far as their gender identity, what society may have as expectations for them. And it will also have a legal framework that probably speaks to it as well, which of late we've seen that more prominently within a US setting where the law itself can dictate a particular narrative and perspective around what gender is. Then sexualities, we tend to think that we are speaking to just queer people, But I mean, everyone has a sexuality, you know. So when we're speaking really about sexualities, we're predominantly looking at what, how someone is attracted to someone on two or more level. That may be a romantic attraction, that may be built based on a personal interaction between you and that other individual. Sometimes that person's gender matters. Sometimes that person's gender does not matter. As far as intersex bodies, there may also be some level of limitations. So then when you're thinking around individuals like pansexuals, then you know that they have a sexual and romantic attraction or an attraction based on one's personal connections that does not matter or take into account their gender identity and expression or their biological makeup as well. As far as then where prejudice steps in is that there are misconceptions, and a lot of them would be informed by a binary. And the binary means that there's either this or that. So we think when you're born, it's either this genitalia or that genitalia. You know, it's either you're going to be male or female. And when we're thinking around gender, we tend to think that you'll either outrightly be performing particular roles based on your gender. And I mean, we see that with gender reveal parties and baby showers, how that can be quite reinforced. So at times, really, when we are speaking around those misconceptions, they tend to be there. It's around what bodies we think people should have, what kind of roles or how they should show up, how they should dress. And that can be limiting in many instances where people are meant to access public services, for example, because that level of stigma or the expectations that people have can lead to stigma, where if someone doesn't quite fit into what we deem to be normal, then we tend to exclude them from accessing even that which is already accessible or should be accessible to them. And that's where you really would find a great limitation as far as even within the healthcare sector. We are not quite thinking broadly or even conscientizing our medical students around the kind of diversities that are the bodies that walk around, you know, the kind of bodies that exist. And they're seen as anomalies, but then I think what we are coming to see is that, especially as far as even intersex bodies are concerned, the people's bodies aren't binary as much as we present them to be. And even from a training perspective, we can set up doctors to lack capacity in serving intersex bodies and serving trans and gender diverse individuals, simply because we would be doing it through the lens of our binary and not having an appreciation of the diversity of the people that they would need to be taking care of.
Okay, since you know that we in healthcare facilities we've got a lot of challenges. How do these barriers entirely impact the challenges that actually bring up pertaining sex, gender, and equality? Because we know that we've got a different type of people who are from the LGBTI community. Pertaining, how do those barriers entirely impact them?
I mean, if you're thinking even from an HIV/AIDS perspective, how there was a lot of stigma in a particular narrative that placed, I would say, fault and blame on queer, particularly gay individuals as having been the ones who have brought in this particular ailment and are part and parcel of the reasons why it has spread and has impacted the nation at the level at which it has. So you automatically open up when you move towards stigma, and usually that stigma is imposed by social structures such as morality, such as culture as well. And I mean, if you think of the kind of country that we are in, culture, tradition, religion are heavily embedded in terms of how we do our day-to-day works, how we interact with each other on a day-to-day basis. So the moment that comes into effect, people are not necessarily treated for the ills and ailments and the concerns that they may show up with. But then a level of care may feel as though these individuals do not deserve care because they have done this to themselves, or we do not need to necessarily prioritize these individuals because as far as we are concerned, they don't meet the standard of humanity that we may desire or that we may have established in our communities and societies. I think that's definitely one. It's also the fact that, for example, if you're thinking around transgendered individuals and what would be their gender affirming surgery, that surgery is not seen to be necessary. It's seen to be a cosmetic surgery. It's no different to you trying to get surgery to look better as far as it is concerned. And what we are also seeing of late is that the access to medication for them to be able to do that for themselves has been even severely impacted by a shortage of resources. So resources that used to be available to capacitate clinics that had a particular focus on giving the kinds of services that trans individuals would be needing as they are transitioning have now been depleted. And I don't think there's an appreciation of the fact that those services haven't quite been prioritized within the public healthcare sector. So having NGOs and other entities now not having the kind of funds that they were able to use to tap into to provide services and provide safer spaces as far as healthcare infrastructure is concerned are now not going to exist. And what does that look like for the access to healthcare of those individuals who need it?
Then pertaining, that with the social norms and the expectations, how do they influence the health facilities? And we know that once a gay person enters a health facility, there's always those people who are influenced by them, because it lends up to a conversation where I was going around somewhere in Gandhi Square, and I was just passing, and there was a gay person that was passing. And this guy, as I went ahead, he went like, this person needs a beating and all those things. But now we are talking about the healthcare facilities. How does that entirely influence such behaviors in the health facility? Because we do have some healthcare professionals that are against LGBTI communities. Yeah.
I mean, look, it definitely impacts the attitudes at which they are interacted with. So it's not really a rights issue more than anything else. It's just that at times, based on things like morality, religion, culture, and traditions, people may choose to opt out of serving other individuals simply because they do not agree with their life choices. They do not agree or incline themselves towards affirming their gender identity as well. And that's really where the bulk of the issue is. I think if we are open to moving away from things such as stigma, you can actually be in a position where you can openly hear what people's concerns are, what are they presenting with, and not think, okay, this person probably is here because of an outcome of their life's decisions, but it may be a kind of harm that whether they were queer or not, that is still possible. Whether they were transgender or not, is still possible. So I think at the biggest level is there at the stigma level. Also, I think when we are speaking around youth-friendly services, for example, in that context, we conscientize and prepare healthcare providers to be conscious of the needs of young people and what they need to feel as though they are welcomed and affirmed within the healthcare space. And I think we haven't quite done enough of that within the healthcare sector as far as being gender affirming and as far as being as inclusive as we possibly can be of gender diversity and sexualities. So there's a lot of demystifying that needs to happen. There's a lot of humanizing that is necessary if we are going to achieve that level of inclusion and create a safer healthcare system. And a safer healthcare system would mean that those who may not necessarily identify within the binary are able to access these spaces with the confidence that they will not be stigmatized, but they will be addressed at their point of need.
As we know that I've got an ID, a South African ID, and you know that, and I'm a transgender. How does that entirely? What roles literally that plays a role? Because you know how health facilities are, and entirely how does that play a role in ensuring that we can be able to get the systems right and creating a barrier, but basically like channelizing from the barriers of identification, because you know that I've got an ID, and you know there's always that certain person that will judge me pertaining my ID. How do we transform that entirely to ensure that also that has been modified properly?
Look, so from a position of a name, right? I mean, you and I can go and, you know, with the Birth Registers Act, we can go and change our names, and that is what it is. There's no requirements towards doing that. More than anything else, as far as going to the point of having even our legal documents changed, that has particular requirements and processes. So I may identify as a trans individual, and I may be in a position where I want that to be affirmed by my legal documents. But there are processes that you need to go through. If you haven't started your medical process and your medical transitioning, you wouldn't be able to do it. And that may be the consumption of hormones. For some people, it would be a case where you've actually had some surgery done. Then the sex characteristics, as far as your identity documents, can start to be considered. It would require 2 letters from a medical practitioner affirming that indeed you are in the right state of mind to have your sex characteristics changed as far as your identity document is concerned. All that simply means that there is actually barriers that are set in place that limit how the extent to which you can socially integrate. If it would so much being dependent on ID numbers, with so much being dependent on institutions looking at your ID number and making determinations around your sex characteristics, and a determination around what gender expectations they can impose on you, that creates a limit. What it also does is that you find spaces where, and that's why we would say we need safer spaces that are mindful and conscious of these dynamics. It's that when you usually enter into a hospital or a public healthcare institution, there's a lot of interaction that happens in front of everyone around your identity. Therefore, I get to be berated in public before I have even my healthcare needs addressed to. If we had a more friendlier system, that would not need to happen. We also create an instance, an opportunity where people can feel the right to speak as they wish and say things that may be harmful, things that are discriminatory, and things that really ostracize the people who the laws have taken an effort in including as well. And that's where you really find yourself as far as those identity documents are concerned, to say that also an affirmation, coming to a point of affirmation where your documents are actually changed, equally is currently quite a privileged thing to come to. Most medical aids wouldn't even cover for the 2 medical practitioners in the context of you trying to get gender affirming surgery. So there are a lot of complexities before you even come to the point where you meet the healthcare professional who's meant to cater to your needs. And all of them are simply based on you not being deemed or qualified, even legally, let alone socially, to identify as you desire. And that can leave you vulnerable to stereotype and vulnerable to being berated in a public space and setting, vulnerable to being made a mockery of in front of other patrons or individuals who may be coming to get particular services. But also it has the outcome ultimately to limit the kind of healthcare service that you receive that could be life extending or life preserving, simply because someone has a disassociation with your gender identity.
Since you touched about like AYP services and safe spaces, how can health professionals create a safe and inclusive environment for LGBTI communities? And what strategies do you think that will literally play a critical role in shaping that design?
I think, look, I've seen some people speak around having specific clinics for LGBTQA plus people. I hear its merits to certain extents. It can explicitly safeguard, but I think it can also lead to a position where you've actually segregated these individuals from the rest of the community. And I think that's quite important to note. We do usually, as far as AYP services, want them embedded within the broader infrastructure of a healthcare system, for example, rather than segregating them and taking them completely out of that space to seek out other services. But what you can do is, I mean, the use of gender inclusive restrooms communicates automatically from the word go to gender diverse individuals or to queer individuals that space is affirming of them, at the very least from an infrastructure point of view. Other ways in which you are able to do that for healthcare services, I mean, we've seen it with ourselves in the higher education sector, is that especially for like healthcare practitioners, as they are studying, they can get taught the anatomy, but they're not being taught the complexities of it as far as what happens when a gender diverse individual comes in. So a lot of people just don't have an understanding of it. So they are not necessarily relying on credible knowledge in terms of, or as far as how they may navigate these bodies. It's often founded upon ideas, stigma, stereotypes, assumptions, urban myths, and urban legends around these individuals' identity and bodies. So I think if you are actually able to get to a point where you are able to take people who work in the healthcare sector and teach them what we mean by sexualities and teach them what we mean by gender diversity and actually have them, instead of stereotyping, but to come to a point where they actually have a better understanding of the kinds of harms, vulnerabilities, and risks that are faced by people who are gender diverse and faced by people who are intersexed, faced by people who are in the LGBTQA plus community, then it will elevate the level of serve that we are able to give to them within those particular spaces as well. And I think even better support them in their transitioning as well. We would be able to see the importance of the kind of relief that gender affirming surgery would have, rather than seeing it as something that is cosmetic.
Okay. Then what are some of the successful strategies and programs that are already that you feel that we've been put into place pertaining sex and gender and sexuality? What are some of the successful things that you know that have been put into place?
Look, I think a lot of laws have been put in place, and I think that's really quite help. Even from a workspace, we see employment equity as affirming also of gender diversity. We have the Pepuda Act as well that's in place. I mean, there's so many policies in place that can even help you with guiding how you navigate the changing and altering of sex characteristics, or changing your name descriptors and so as well. But I think more than anything else, where we are right now, Tshepo, is that there are institutions that have taken it upon themselves. So there are institutions that would affirm a gender diverse individual's identity by allowing them to speak, for example, in their own, not speak, but be called by a name that they choose and have the pronouns that they seek to use. And I think University of Pretoria was amongst the first institutions to really put that forward and affirm the identity of gender diverse individuals in that regard. But we're still in a position where we haven't quite touched the attitude. So legally, even as policies are concerned, procedurally we can have achieved inclusion. We can have achieved the extension of rights, and that's in line with the Constitution of South Africa. That's in line with affirming the Bill of Rights. But we just find ourselves in a position where there is that procedural justice that is achieved, but the substantive justice is not achieved. And when we speak about substantive justice, we speak about really being able to access and realize those rights and privileges as they are afforded to you within the Constitution. And that's where we have limitations. Infrastructurally, yes, gender inclusive restrooms and bathrooms, fantastic. Within that particular infrastructure, having signage that is affirming and speaks to the issues and concerns of gender diverse individuals and of people experiencing marginalized sexualities, you'd be really good. Being able to secure healthcare services that specifically cater to transitioning individuals as well would be quite fantastic. Training that addresses the kind of attitudes that allow stigma to thrive and that allow or create a conducive environment for people to be discriminated within the within the healthcare space and even higher education spaces, becomes quite important to do. But we do need for those rights and privileges as afforded to them within the Constitution to be accessible and tangible and not be subject to discriminatory practices, particularly within, for example, the employment space, right? We see this also in higher education as well, and we are seeing it now as far as what's happening in the US as well. It's important that policies at a ground level are affirming of the gender diversity and inclusion, are affirming of the right to access of healthcare for our diverse bodies or people who are marginalized in our communities. And it shouldn't be something that is just placed at the level of policy. And I think we've done that. And we, especially within the South African context, what we really do well is putting together policies. And to be quite honest, the policies are there, we just really need to deal with what is a perceived right to opt out of giving care and service to particular individuals just because we do not agree with their life choices, we do not agree with their gender identity, we do not agree with who they have sex with and how they may even choose to have sex. All those things come to be conflated in an array of dynamics that intersect with each other to create hard circumstances for individuals who are gender diverse to live and thrive. So I think we don't really need to, the policies are there. We need to do a lot better around behavioral change, around changing attitudes and sentiments towards gender diverse individuals. And I think if we can get that right, we probably are going to realize a much more safer and more accessible healthcare system over and above other spaces in society that exclude these marginalized individuals.
Just in closing, for a simple person that out there, plus in the beginning I asked you're a speaker, so can you give someone like a positive message out there of hope? Probably thinking that, I'm being stereotyped, stigmatized in certain behaviors at health facilities, and
Look, I think more than anything else, it's important to just be in a position where if you are trans, if you are intersex, if you are gender diverse, to be affirmed that really and truly you are not an anomaly. You are not part of that which people may stigmatize and brand you to be, but you form part and parcel of the diversity that our country needs to move forward, part and parcel of the diversity that really makes up the kind of country that we love to live in and appreciate to exist within. So have a level of pride, and I think it's good to affirm that in you as well, and find organizations that are doing work that will affirm your existence. Find organizations that are doing work that support the broader inclusion of individuals like yourself who may be marginalized in a country and communities that really do not have a level of understanding, a level of literacy around what your lived experiences may be and how you may be navigating your own body from a day-to-day basis. And I think maybe even for ourselves, let's find opportunities where we can embed them in our programs, embed them in the interventions that we do, so that they don't just come to be seen as a feature as far as when we speak gender diversity alone, or a feature as part of when we are speaking about Pride Month or International Pride, as far as the LGBTQI plus community is concerned, but that it becomes normalized for us to reach out to them as well and affirm them that there are spaces that are inclusive of them, and give them a level of prominence also in our programs so that we can actively destigmatize the kind of stereotypes that keep them marginalized in our communities.
I must say, Tumelo, thank you very much. I think next time I'll call you again and, you'll give more profound, because I feel so inspired. But without further ado, from our wonderful guest who literally talk about sex, gender, and sexuality. And that's the information that we had gotten today. It does not mean you should just let it go. Take it, install it in you, and actually use it to advocate pertaining your work that you're doing in your communities. But simply follow us for our next episode at 3 p.m. next week, and simply just go to our all social media pages at Senec_trust, and simply go to our call to action number at 067 267 3103. Sharp.